So what is obesity? Obesity is typically defined as having a BMI or body mass index of either 30 or more. BMI score is calculated by dividing a person's weight in kg by the square of height in meters. However, there are also some limitations associated with BMI. Experts say that factors like an individual's sex, age, ethnicity, and muscle mass can also have an influence on the relationship between body fat and BMI. In addition to that, BMI also does not distinguish between muscle, excess fat, and bone mass, and also does not give information regarding the distribution of fat in an individual. Despite all these red flags, it is still very commonly used as an indicator of excess weight. Also, the types of obesity depends on where the BMI lies. The most common obesity symptom is when your BMI is 30 or more. We have also understood how BMI is calculated for an individual. However, let us understand this is a little more in detail and educate ourselves. When the BMI is below 18.5, an individual is underweight. When the BMI is between 18.5 to 24.9, the individual has a normal weight. When the BMI is between 24.5 to 29.9, the individual is overweight. And when the BMI is 30 and higher, the individual is in the obese category. Apart from that, the most obvious obesity sign and symptoms are when an individual starts panting after walking, just a few steps or climbing a few flights of stairs, or doing any physical movement and has to stop and catch a breath. So any individual may be prone to obesity risk factor depending on different factors. First is genetics. Some people have certain genes which makes it increasingly difficult for them to lose weight. Second is the psychological factor. Factors such as stress, depression, anxiety have also been known to contribute to weight gain, as a person facing these usually turn to food for emotional comfort. Third is environment and community. The environment at your home, school, office, and in your community has a big role to play in the kind of food you eat and how active you are. Smoking too much is also said to contribute to this. Fourth is certain medications. Medications like certain antidepressants, birth control pills, and steroids are also known to contribute to weight gain. So understanding the causes of obesity is important in order for you to understand if you need to find a suitable obesity cure or not. Having a diet that is high in fats and calorie and burning fewer calories in a day than you consume. This causes all the extra calories to add up and excess weight gain in the long run. Second, not including any sort of movement in your daily life and staying sedentary or inactive for most part of the day, or getting inadequate sleep, which is linked to craving for high calorie food and hormonal changes, which causes you to feel more hungry than usual. The genetic factor. It influences how fat is stored in your body and how your body ultimately processes food into energy. Also, some medical conditions like PCOS, Cushing syndrome, and osteoarthritis also contributes to weight gain. So how do we get to know? One of the most common and widely used ways of diagnosing the problem is to look at the relationship between an individual's height and weight and then arrive at the body mass index of the person. Second is the skin fold thickness. It is a method used to measure the body's fat of an individual and the body fat distribution. Waist and hip comparisons is also done to determine which area has most amount of fat percentage present. An understanding of the amount of fat that is present around your waist and hip area is a good way to predict for any diseases related to obesity. There is a couple of obesity tests like an ultrasound, a magnetic resonance imaging, also commonly known as an MRI, that the doctor might prescribe you to do in order to understand your body better. These tests generally include liver functioning test, blood tests, to examine glucose levels and cholesterol, thyroid test, diabetes screen, and certain heart tests like an electrocardiogram. Despite the diagnosis seeming very easy, it is always best to consult a good doctor and not go for self-diagnosis at any point or start taking medications on your own. Obesity treatment is certain to mix of things that an individual needs to do on their own and certain things for which medical help might be required. The first and foremost thing to do is to change your diet and lifestyle, starting eating healthy and including exercise in your daily routine. If you are unable to lose weight on your own by diet and lifestyle changes, then a bariatric physician is someone you can consider. They specialize in helping the individuals to lose weight without the need of a surgery. Your doctor can help you to get in touch with a team of a dietitian, personal exercise trainers, and healthcare staff who will get you on track for a healthy lifestyle. There is certain obesity medicines also that can help you. There are some very basic things that you can incorporate in your daily life in order to prevent obesity. Make good lifestyle choices by including a form of exercise that you enjoy in your daily routine. It can be swimming, biking, or even dancing. Select it and do it for at least 30 minutes daily. Have a healthy diet in place which includes a mix of proteins, carbs, fiber, and other important nutrients. This is possible when you eat a mix of vegetables, fruits, lean proteins, and whole grains. Mental health also plays an important role in this, so make sure you include practices like meditation and getting adequate sleep every night.